Hello, everyone, and welcome to this week's Coalition Conversations. My name is Fiona Kyle, and I'm the CEO of Mental Health Reform. Mental Health Reform is Ireland's leading coalition on mental health. We are a membership organisation and have 75 members representing a diversity of different interests, including children's rights, disability, homelessness, human rights. And what all our organisations have in common is that they're all working towards the reform of Ireland's mental health policies and services so that everyone in Ireland can get the help that he or she or they need in their own communities to achieve their best possible mental health. And mental health reform provides the platform for our members to come together and to share experiences and to speak with one strong voice towards the government and other key stakeholders. This is, I don't know what week it is in terms of the kind of the webinar and the coalition conversations, but we're delighted that it's been such a huge success. And as I say every week, it is a conversation. So do please join in by chatting, using the chat box, using the Q&A function, and also by tweeting any thoughts that stand out from the webinar, any thoughts that stand out in the webinar on social media and the hashtag coalition conversations. So this week we are going to be talking about gender and in particular the impact of COVID-19 on women's mental health. I think it's actually a very appropriate time to this week. I'm sure we've all seen the conversations in relation to the discussions around, women's bodies that have been happening online and in the media yesterday and today. And I suppose a question we often get asked is, why focus on gender and the gender impact of mental health? And I suppose very simply put, that we all know that there are social detriments that affect mental health and mental well-being. And we do know that women are disproportionately kind of, I suppose, impacted by some of the key risk factors, including poverty. They're more at risk of violence, including gender-based violence. Women are also, in general, may have low social status, and they have the disproportionate responsibility for the care of others fall disproportionately on women, as we know. And these lived realities shape women's experience of mental health. And in particular, the COVID pandemic has meant an increase in stress and anxiety and has adversely affected the mental health and well-being of women in Ireland. And we do have two expert speakers who are going to speak to this today. But it's also just to bring your attention that this week that Mental Health Reform have partnered up with the National Women's Council of Ireland to put out a joint policy statement on the impact of COVID-19 on women's mental health. Again, the statement really looks at how women are disproportionately in Ireland represented as frontline workers and have been, those frontline workers have been operating, as we all know, under tremendous stress with the closures of schools, of childcare, falls on women. Women are in abusive relationships across Ireland, have been locked up with their abusers. So we'll be exploring this and many more kind of impacts on women in this webinar. And this is also covered in our statement with the National Women's Council of Ireland. To note that Ireland's new mental health policy, Sharing the Vision, has for the first time addressed the need to develop gender-sensitive mental health services. So that is the first time that in any policy that has been recognised as something that we need to work towards. But we all know that we need to make these words reality. We need prioritization and investment. And that is what ourselves and the National Women's Council of Ireland are calling upon in our statement. So please, I'm going to put it in the chat box, but please retweet this statement and create as much noise as you can around it, because we really want to ensure, as will become clear in this webinar, the real need for gender sensitive mental health services. So without further ado, I am going to hand over and to introduce our first speaker. So I'm delighted to introduce Aoife Price. Welcome, Aoife. So Aoife is a research fellow working with the European Disability Forum, and she is currently researching women with disabilities and their experiences in activism and in social movements. And as part of this project, Aoife is completing a PhD at the National University of Ireland in Galway, and she's very personally interested in women's mental health and has worked as an expert in the area, having worked on youth mental health issues for many years. So Aoife, over to you. Thank you.
Great, thank you. Just get up the screen here. Sorry, here we have it. So first of all, I just want to say thank you very much for having me here this morning. This is something I'm particularly interested in. I'll bring you through my presentation. First, I'll tell you a bit about EDF, where I'm working at the moment, and then I'll talk about women with disabilities and violence against women, and then I'll go on to talk a bit about some conversations we've been having in EDF around women with disabilities and the COVID-19 pandemic. So first of all, just a little bit about EDF. So the European Disability Forum is an umbrella organisation of persons with disabilities that defends the interests of over 100 million people with disabilities in Europe. So we are an independent, non-governmental organisation that brings together representative organisations of persons with disabilities across Europe. We are run by persons with disabilities and their families, and are a strong united voice of persons with disabilities in Europe. And just a little explanation about the DARE project, and that's the project I'm on, that is a disability advocacy research in Europe. It is a project under Horizon 2020 that's funded by the European Commission under the Marie Curie scholarships. So it's a European-wide training network for early stage researchers in the field of disability rights. And I am one of those researchers. The project's being coordinated by NUI Galway, and it has 7 partners from all over Europe. So just some information about the prevalence of disability among women. So an estimated 1 in 5 women live with disabilities, and the prevalence of disability is higher among women than men. Then with women, it's 19.2 versus 12% of men, and contributing to this higher level is lower economic and social status of women, gender-based violence, and harmful or gender discriminatory practices. So then, just looking at people with disabilities, women make up nearly over 60% of people with disabilities, and men make up just under 40%. So just to put that a little bit in perspective, there's more than 60 million people, women and girls with disabilities in Europe, and this is equivalent to the total population of Italy. Then to just talk a little bit about COVID-19 and inequalities and how it has impacted on people with disabilities significantly. So the impact, this is taken from Mental Health Europe, the impact of COVID-19 is hitting some communities harder than others. It's heightened existing inequalities and worsens the position of those already facing social and economic difficulties. And these social inequalities contribute to some of the main factors leading to mental ill health. And then just a little bit about how mental health services have adapted to COVID-19. So what Mental Health Europe has found is that community-based support and services have shown great flexibility in adapting to the pandemic by quickly reinventing themselves. Unlike long-term institutions, these services were able to support recovery in line with human rights standards and guidance. So as well, I suppose one thing to highlight is that prior to the pandemic, it was very hard to lift online psychosocial support to get it off the ground, but now it's become a daily part of the routine of many people and with mental health difficulties. And of course, it's not the same as face-to-face interaction, but it is still significant in that it has allowed people to continue their care and support during the time of the pandemic. Just as well to note about violence against women and girls, the United Nations considers it as one of the most systemic and widespread human rights violation, and it's rooted in gendered social structures rather than individual or random acts. It cuts across age, socioeconomic, educational and geographic boundaries and is a major obstacle to ending gender inequality and discrimination globally. Then just talking about in the context of violence against women and girls with disabilities. So compared to non-disabled women, women with disabilities are at greater risk of severe forms of violence. They experience violence at significantly higher rates, more frequently, for longer, in more ways, and by more perpetrators. They have fewer pathways to safety and are less likely to report experiences of violence. Just an example of one type of violence among women with intellectual disability. So it's 3 in 10 women have been sexually abused, but this increases to 6 in 10 women who have an intellectual disability. And that's research done by Inclusion Europe, which represents people with intellectual disabilities at a European level. So in June, we held an online webinar on COVID-19 and the impact of COVID-19 on women. So this is just taken from some of the content of the webinar and the speakers of the webinar. So one of our members from Italy has said that she was a speaker at the webinar. She said that many women and girls with disabilities have been feeling left behind, unheard, isolated and alone during the pandemic. And she also spoke about how countries have really forgotten about their obligations under international treaty and human rights conventions that they ratified. For example, the UN Convention of Rights of Persons with Disabilities was ratified by all EU member states. Then the same person said that many women and girls, I'm having a problem with the slides, it's not going to the next slide. Okay. So as well, domestic violence has increased by 1/3 in Europe during the time of pandemic. Even though violence may concern all of us, women and girls with disabilities are already more likely to suffer from violence and abuse. But despite the fact most of the supports are not actually accessible, and many of them don't have accessible information available to women. So the European Women's Lobby said that particularly people with pre-existing health conditions and those living in institutions were impacted by the pandemic. And it has devastating consequences in many cases. Also, quality services and support were not always available to women, and they were left in isolation or in danger. And the impact on women's mental health due to this pandemic has been massive. So just a little bit about we have a Women's Committee in the European Disability Forum, and the Women's Committee is made up of members from all over Europe representing different groups of women with disabilities. And the Women's Committee ensures that the perspective of women and girls with disabilities is heard and acted upon. And some of the points raised here are very specific to the individual's disabilities. So I've more or less taken how they described the situation. So I'll go through that. So in Sweden, a member highlighted that there was a deaf woman's helpline for people worried about COVID-19 and suffering violence. Then in Romania, we have a member with an intellectual disability, and she spoke about how measures were taken that she was not allowed to exit the group home and no visitors were allowed in. She knew this was to protect them, but she felt that it affected her liberty, not being allowed to leave the apartment. And she said the situation was very difficult living in a residential institution. She also noted that it's hard for people with intellectual disabilities to understand the situation. In Croatia, the Deaf Blind Association brought interpreters to meet people in their homes to feel less isolated. The Red Cross opened a helpline for psychosocial support. The woman from Croatia noted that civil society was more responsive than government, and she felt there is no measures directly applied to women and girls. And then in the United Kingdom, the member there raised the issue that the government had not supplied personal assistance with protective equipment and materials. And she also noted that throughout the UK, there was a failure to provide accessible information, and that there was differences between the different nations in the UK. So for instance, Wales and Scotland, there was sign language interpretation and clear instructions, but this was not the case in England. And then I just wanted to highlight one example of a women with disabilities organisation in Spain, and the actions that they took to support women with disabilities during the time of the pandemic. So this organisation prepared guidance for women and girls with disabilities to have information to address domestic violence. Every Wednesday, a webinar style meeting was held to share information and support with each other. And then they also met with government officials to ensure that disability and gender is taken into consideration in all policies. So that's it from me, but I just want to highlight my contact details and the contact details of EDF. And I'm very happy to engage further with anyone who's interested in this. And I have provided Amy with the slides, with a PDF of the slides. So she might be able to distribute them or put them online so you can have these contact details for yourself. And then I just wanted to say thank you so much for your attention. It was a really great opportunity to talk here today about such an important issue. And I hope I provided interesting information for you, and thank you for listening.
Thank you, Aoife. That was really, really interesting. And you know, some of the key things that stood out for me was, you know, the point you raised about, you know, people's voices not being heard, you know, especially, you know, women with disabilities in particular. And it's quite stark, you know, there's lots of good work happening, but you know that there's not that gender isn't being taken into consideration maybe as much as it should have been or should be. And it's great to see the examples from Spain, and you know, it's always good to look at what's being done and what, you know, we can put forward. But yes, certainly it really speaks to the fact that, you know, COVID, it's not a great leveler, that people, you know, people are facing many challenges. And you know, there are many barriers that many different groups, including women in general, but of course women are not a homogenous group either, you know, and neither are women with disabilities. But yeah, we'll get, I'm sure there's people are saying the presentation was great, Aoife, and we'll get to the Q&A after Louise's presentation. So I'm just going to introduce Louise now onto the call. So Louise O'Leary is the advocacy manager at St Patrick's Mental Health Services, who are a member of Mental Health Reform. So Louise is also the co-funder with the National Women's Council of Ireland, the Women's Mental Health Network. So Louise, over to you.
Thanks very much, Fiona, and thanks for having me here today. I'm really looking forward to the discussion on this topic. So I'll just share my screen with you there so you can see my slides, hopefully. Yeah, I hope everyone can see them. And I'll just go full screen. So I know Fiona and Aoife have very eloquently spoken already to some of the reasons why gender is important to talk about in relation to mental health. So I will just speak a bit more to those issues and follow them through, I guess, to some of the gendered impacts of COVID-19 and what that may mean for women's mental health generally. And also I have some thoughts for consideration, I guess, some ideas around implications for mental health services. I'll try my best to keep to time as well. So as has already been mentioned, gender is recognised as a critical determinant of mental health and mental health difficulties. And the World Health Organization and the UN would very much see this as being largely in part or due to power differentials and gender equality issues. So in terms of gender and mental health difficulties, men and women experience mental health difficulties generally to equal degrees, but there are important differences as regards needs, experiences, and causative factors. And if we become more aware and more responsive to these differences, it will improve the effectiveness of services and also health outcomes and recovery. And I know that's very much a message of the policy statement that Mental Health Reform and National Women's Council of Ireland put out today. When we talk about women's mental health issues, we can't talk about them without placing them in the context of the realities of women's lives. And that's why it's so important to talk about gender and mental health together. in relation to women's mental health. Those three last points there are directly copied from our key principles that are underlying the Women's Mental Health Network, which, just to explain, is primarily a forum for information sharing and networking. And one of its higher aims is to promote interdisciplinary and cross-agency collaboration to advance understanding and awareness of women's mental health issues. So in terms of digging down a little bit deeper into how or different ways that gender inequality or equality links with mental health, some of these matters have been touched on already. Intersectionality, I think Aoife really clearly highlighted how different aspects of people's identity and the circumstances people live in can compound to either result in greater advantage or disadvantage. So the really startling figures there of women living with disabilities who are at greater risk of experiencing sexual violence, for example. I won't go through all of these, but some of them have been touched on already by Fiona and Aoife. I think a particularly relevant one when we think of COVID-19, and that will follow through to the next slides, are around economic inequalities and imbalances in caring roles and emotional labour. So pre-COVID, we know that women around the world did nearly 3 times as much unpaid domestic and care work as men. So there was already a significant discrepancy there. And just to note as well, the last one there around stereotypes, that one I added in because for younger people, the Children's Society in the UK carry out annual studies of young people's well-being, and one of the findings around self-harm linked incidents of self-harm and poor body image to gender stereotypes for both boys and girls. So from a young age, gender equality issues can impact mental health. So if we follow through on some of those themes to the gendered impacts of COVID-19, well, Fiona already mentioned about the situation of frontline workers. So 70% of frontline workers in the healthcare workforce, not just nurses and doctors, but also household staff, etc., 70% are women. Interestingly, as you go higher up the leadership lines, that decreases down to 30%. So in terms of healthcare leadership, women occupy 30% of the role. So there's an inverse there. So when we think of the experiences, the extraordinarily stressful and challenging work experiences of frontline workers, that is being experienced by men and women, but it's more significantly being experienced by women. Impacts on carers have been profound during COVID-19 in terms of both formal and informal care provision. And we know that caring in all its forms is gendered, in that more family carers are likely to be women, and more people who work in social and health, personal care work are more likely to be women. And formal care supports have been interrupted, and there's been much greater demands placed on carers, with a consequence to their mental health. In terms of economic consequences then, I know Fiona spoke to gender inequalities in relation to income and things like that. A study published today by University College London has found that one of the outcomes in recent months is that women with primary school age children are considerably more likely to have given up working than fathers with children at the same age. And that was a really significant study of 18,000 people. So we're seeing economic consequences in multiple ways in relation to women, and there is concerns expressed by the UN, by the World Economic Forum, that these impacts may in the longer term have a result in deepening gender inequalities. In terms of unpaid care and domestic work, I know the National Women's Council of Ireland have done a study which is cited in the position paper, where 85% of the 1,500 women surveyed said that their caring responsibilities had increased. And similarly, that UCL study that's been released today in the UK found that women across several age groups have been bearing the brunt of childcare and homeschooling since the coronavirus outbreak. Aoife's already spoken to the increase in domestic violence, so I'll move on from that, but I'm going to come back to that in relation to mental health. The increase in domestic violence has been described as, or violence against women and girls, excuse me, has been described by the WHO and the UN as a shadow pandemic. And it really follows that if there's been increased contacts to Gardaí of 25% in Ireland, and we know Women's Aid and Safe Ireland are reporting higher still increases in contacts from 40% upwards to their services, it follows that in mental health organisations and services we will also see an increase. So what does all this mean for the impact on women's mental health? Well, in the general population, we're seeing impacts on both men and women's emotional well-being and mental health. But what statistics are showing is that women are being more affected with regards to their emotional well-being and mental health. So these figures are from the CSO from back in May. And these are echoed in international figures that the UN Women have been compiling as well. So this is a trend that's being seen around the world. Coming back to Family Carers Ireland did a survey of 1,037 people, which they published in June. 60% of carers were worried about the decline in their own mental health as a result of dealing with the implications of coronavirus, and 95% of those surveyed were women. In terms of frontline workers, there has been some studies emerging mostly from China. The figures I've included here are from a cross-sectional study that was completed with Italian healthcare workers and is published in JAMA online. You can access it online. 77.2% of the 1,379 participants in the study were women. And you can see there the results were really concerning in terms of mental health impacts. That first one there, just to note, is PTSS. They use that terminology in the article for some reason. It's post-traumatic stress syndrome or post-traumatic stress disorder. Just coming back to the issue on domestic violence, which Aoife has already spoken to, I just think it's important to really put a spotlight on that in relation to impact on women's mental health. Research has found there's a two-way risk indicated. So not only does experience of domestic violence adversely affect a person's mental health, but experience of mental health difficulties increases individual vulnerability to experience of domestic violence. In terms of women's mental health, experience of domestic violence results in a twofold increase in risk for depression. Women who've experienced domestic violence are 3.5 times more likely to experience suicidality and are over 7 times more likely to experience post-traumatic stress disorder. So there's really profound implications for mental health and well-being. So in terms of mental health services and responses, mental health services along with maternity services have been identified as key health sectors to respond meaningfully to domestic violence. And this is because of the high incidence of experience of domestic violence amongst the people accessing services. So it's estimated that 1 in 4 women and 1 in 10 men who access or use mental health services will have experience of domestic violence. But unfortunately, research has also found that under identification of domestic violence within mental health services is also commonplace. So it's estimated that only 1 in 3 incidences of domestic violence are caught. In addition to responding and recognising and signposting to domestic violence agencies, it's essential that mental health services in responding to domestic violence recognise how domestic violence can cause, contribute to and maintain mental health difficulties, and that multidisciplinary interventions and supports are integrated into care plans in a trauma-informed way. In terms of, I suppose I'm speaking in a very broad sense about trends that are emerging in relation to women's mental health, but what's really important to recognise are the different challenges and experiences that different women are facing. Something that's been touched on by both Fiona and Aoife already. So for women who are living in very challenging circumstances, the coronavirus outbreak and subsequent restrictions will have had additional implications for mental health. So, for example, women living in direct provision, women living in the traveller community, and women within the LGBTQI community. I've included a link here to a webinar the Women's Mental Health Network held back in June, which tries to explore and unpack some of those impacts and learn about them. The presenters at that webinar spoke about it much more in a much more informed and expert way than I'm in a position to. So what does all this mean for mental health services? Well, the pandemic has provided us with opportunities as well as challenges, and I really like this idea of building back better, making the new normal better. And a lot of these points are addressed in the policy paper that I think there's a link shared in the chat post that Mental Health Reform and the National Women's Council have published. I think it's essential that experiences of people using services in recent months are heard right throughout the way that feedback has gotten. What is it like, for example, for women accessing support for eating disorders to move to online services? What's it like for older women with mental health difficulties, having social supports and mental health service supports interrupted, and again, perhaps having to move to phone contact? What's been missed for people with disabilities? What are the pros and cons of new forms of mental health services? Who's been left behind? Have people been left behind? I think the gendered impacts of COVID-19 and the implications for women's mental health that are emerging just really reinforces how essential it is that services are both gender informed and trauma informed. And it's great to see in sharing the vision that trauma informed care is one of the key principles planned for service delivery. I'm conscious my time is probably running out, so I will wrap up there. I just wanted to flag a couple of resources that are available should people want more information. These are both available from the National Women's Council of Ireland website, as they were their publications they've been involved in. And then some of the data I have spoke to today is referenced in the UN Women Count Data Hub, which is collating gender data on COVID-19. And then finally, if anybody wants more information about the Women's Mental Health Network, there is further information about the principles of the network and how to get involved, information on past events. So please do have a look at that and contact us if you have any information.
Thank you so much, Louise, and both of you were very much on time. So the good news is now is that we have, we've 15 minutes for Q&A. So just to remind people, there are two ways to submit questions. You can use the Q&A function, or you can just type it in the chat box. But Louise, thank you so much. And what struck me again with your presentation, and it's something we call for in our kind of our policy position paper, is around data. And Ireland hasn't invested substantially in gathering data on the impact of COVID on the population. And we all know the importance of disaggregated data in terms of of gender, in terms of even of disability, because often if you do not counted and if you don't have the evidence, then there's no response there. So I think that's something that I kind of came out clearly in both of your presentations on the need for data and how powerful the figures you both quoted were, and people were commenting about that in the chat box. One other comment I think it's good to note when talking about mental health and women's mental health in Ireland, I suppose, is the journey that Ireland has been on in terms of, in the 19th century, there was very much, it was about kind of an asylum system where, you know, those who were deemed to be mentally ill, and then a lot of them were put into institutions, including women living with disabilities, women who may not have needed to be institutionalized, but we know that women were disproportionately in those institutions and in other institutions such as the Magdalen laundries, the mother and baby homes. So we've come a long way. We've definitely moved to, you know, we're in a kind of a better place on how we view, you know, how we view mental health and how we view women in Ireland. But there is also a tendency to focus on the negative, while actually, you know, we really need to view these women, you know, as being hugely resilient. They're empowered and, you know, very much should be in control of their own recovery. So it's really positive to hear some of the examples you raised, Aoife, in particular around that. But without further ado, I'm going to jump into the questions that have come in. So there was one via the Q&A first for you, Aoife. Is there, for Mary, and Mary asks, is there any evidence to suggest that women are more likely to be discriminated against on disability grounds? And if so, has this ever been addressed at European level?
Yeah, I suppose as you say, there's difficulty in data, and particularly in disaggregated data. So data is there, but it's not disaggregated between, often it's people with disabilities rather than men and women with disabilities. Often it's grouped in with older people, for example. But the data that we do have available does show that women are particularly discriminated against, and that the European Disability Forum is working on a European level to address this. We're members of the European Women's Lobby, and we work closely with them on addressing these kind of things. But EDF have a very important voice in Europe, and a very good relationship with the European Commission and the European Parliament in advocating for those changes that are required for women with disabilities.
That's great, thanks, Aoife. And just for balance, there's a question that came in for Louise. So Louise, Lorna asks that she would like to hear your views on body image and the objectification of the female body with regard to higher incidence of eating disorder and body dysphoria among females. And she'd also like to hear more about what Mental Health Reform and the new Sharing the Vision framework hope to do to address these conditions which predominantly impact in women, and the impact of these conditions is frequently belittled and mistakenly thought to be a choice and related to vanity. So if you want to take the first part, Louise.
Yeah, I feel like we could have a whole other webinar just on that topic, so thanks for the question. Certainly, I worked in eating disorders for several years and did some further study on it. And one of the models of understanding eating disorders is from a feminist perspective. So people like Susie Orbach would very much be a proponent of the idea that issues like sexual objectification of women has added to it. And there's a lot of evidence as well that would support that view. There was a study in the 90s which followed the introduction of TV to Fijian islands, and prior to the introduction of with a lot of westernized American television, and prior to the introduction of television, incidence of eating disorders was very, very low, if negligible. Following the introduction, all of a sudden, it increased substantially. So there is certainly evidence for that. I mean, there's also lots of other reasons for that eating disorders can develop, obviously, including experience of trauma, etc. But certainly there is strong evidence that would support that interpretation, at least as a contributing factor, and not just in relation to eating disorders, but in other mental health issues as well. So that Children's Society study I noted would have found associations between incidents of self-harm and body image concerns, for example, within young women, and also tied to gender stereotypes and things like that. I hope that answers the question.
Yeah, I think so. And I think just in relation to the second part, you know, mental health reform is a very strong advocate in the fact that, you know, there are social determinants that impact everyone's mental health, and it's been very clear during COVID. And I think, you know, some of those social determinants are, you know, as you explained, are the kind of are how women are viewed in society, and also men. I think we need to be aware of the kind of the whole concept of toxic masculinity, but that you need to be perceived in a certain way, and if you're not perceived, if you don't self-perceive in that way, you may run into kind of I suppose additional barriers, and it may impact on your mental health. So there's a huge amount of work to be done, and the policy does, you know, it does say it's for the first time it recognises the need for gender sensitive services. It's a whole of government policy as well. So I think that's really important. Yeah, to recognise that mental health, it's not just a health issue. You know, this concerns, you know, the Department of Justice and how they're treating, you know, the violence against women, the implementation of the Istanbul Convention, how women can access employment through, you know, the Department of Social Protection and others. So I think that's really good, but it's on paper. So we need to, you know, to really push so it's prioritised and it happens. So there's a really good questions coming in, and keep sending them. I'll get to as many as we can. And there's a few I'm kind of going to group together and throw out to both of you. So Christine, I think that's the name. So she wants to know, do we have any information on if women living with domestic violence in relationships, you know, in domestic violence relationships, are using online services during the pandemic, and has there been a safe way for women to reach out? And I'm just going to put that together. There's another question in the chat box that came in relation to, you know, in Ireland, Zoom meetings, team meetings, etc. You know, do they practically help women? And if not, what could we do, you know, in the future to better support? So that whole area of access and of technology, if you both had reflections on those. So maybe going to Aoife first on that.
Sure. Yeah, I suppose the example from Spain would be very clear in that the women there provided a safe space every week to meet together to discuss issues. They also provided accessible information on domestic violence and distributed it to women with disabilities. That's a huge issue that, you know, we have, is that some of the information provided is not actually accessible, and even more worrying, some of the services are not accessible. But also we had training from Inclusion Europe, which represents people with intellectual disabilities, and there was a young a man there. He was co-presenting, and I asked him, I said, how do you find the online conversations? Have you been able to adapt to them? And I kind of made the point that we're all finding it difficult, but he said that there's self-advocates all over Europe, and they have continued to support each other online, which is really wonderful to see. That definitely a lot of the disability movement has moved to online, and for example, we had a lot of seminars on or webinars, I should say, on the impact of COVID, along with other things to do with disability. And also the International Disability Alliance had a lot of webinars. So I suppose we have really, the disability movement has really utilised the pandemic and tried to make the best of the situation. And I suppose one of the positive things is that, you know, we could reach a huge number of people. I know at some of the webinars there was, you know, hundreds of people at them. So it also is very accessible for people with disabilities who may not be able to, or it may, especially in these times, it's just not safe for people maybe with underlying conditions to put themselves in danger. And many people just are nervous of the situation and don't want to put themselves in that position. So I would say yes, that although everyone was kind of terrified of going online, we've done it, and I think it's been successful, and it will really change how we do things going forward, I think, and we will really utilize online webinars so much more than we have in the past in terms of reach and everything like that. But yeah, just going back to the self-advocates and that question that I put to that person, he told me that that they were communicating online and had support groups and everything like that. So.
Thanks. Louise, do you want to come in there, maybe around Ireland, specifically in the domestic violence question?
Yeah. So, funnily enough, we actually had a presentation in St. Patrick's, on site in St. Patrick's Mental Health Services yesterday from Linda Smith, who's the National Women's Aid Free Phone Helpline Manager. So they increased their instant messaging and online supports during the pandemic, and some of the figures she shared was that there was a 78% increase in their instant messaging service and a 30% increase in the email support used, and that's in addition to a marked increase in their telephone line. So absolutely, I think people being potentially trapped at home with their perpetrator and not getting privacy meant that alternative routes to accessing support was important. Just a note as well, something that I thought was of interest that Linda raised was that it wasn't just contacts of people experiencing domestic violence currently that they were getting, but also of women who'd left relationships sometimes several years ago, but who were finding they were getting re-traumatized by the sort of loss of power and the restriction in their environment was triggering memories of the experience of living in coercive control relationships. So that's something I think we need to look out for as well with the people we're working with.
That's great. Thank you both. Lots of questions coming in, so I'm going to put a few to you now. I think there's a few coming in on young people. So Bernie in the chat asks, are there similar patterns in young women's mental health compared to young men, or is it too soon to tell? And then there's a similar question in the chat box that asks in terms of that what were the main themes impacting women's emotional health. I think you quoted some CSO figures, and you know why are women, I suppose, emotional health worse, is Keelan is asking. And then there is a question on the views on mental health and the well-being of the transgender women during COVID as well. We know that there's been impact there, and there is, then I'll come back for one final round of questions. There's a few really interesting ones just come in, and we might finish at 5 past if that's okay with everyone, because the questions are really interesting. So I don't know, Louise, do you want to take that first one, and then Aoife, if you wanted to add anything, please.
Sure. Yeah, I actually prior to this this role, I worked with the Union of Students in Ireland, and we have a massive amount of data. We carried out a big survey on student mental health. And we were also very involved in the Out of Silence report that was done by the National Women's Council of Ireland. So I just said I'd share that, was kind of the main things. But I'm actually working on a number of papers at the moment that look specifically at women, young women's mental health. So that's really prevalent. And there definitely is differences between the experiences of men and women on that. And I suppose that's prior to COVID. So I don't have any information on Louise, I think would be much better put to answer that question in regards to COVID, working in St. Patrick's. But for me, I'm very aware of the situation prior to COVID, but I'm not aware of the situation at the moment. But I can imagine, like Louise said, that, for example, you know, domestic violence, people with eating disorders, you know, that there's been an increase in kind of in people feeling very restricted. So that's just from a personal point of view. I think that must be a situation. And yeah, that's kind of, I just said I'd mentioned that about the USI report, and I can link that. But as I say, the report is very much an overview, and we're really digging into the data now at the moment.
I think we'll wait to see what Aoife's. I don't think I have a huge amount to add to that. I think the fact that there's research happening at the moment will be really helpful. I do recall at a previous mental health reform coalition conversation webinar a couple of weeks ago, and the presenter from Jigsaw saying they were noting impacts at an older age than you'd expect, sort of 18 to 21. I don't know what the gender breakdown is of that, to be honest, but I think it speaks to that transition to adulthood and the expectations, you know, of what your life will be like, and how important social life is at that point. There was a study done, I think it was a European study done during COVID as well, which found young Irish women had one of the highest scores in relation to experience of loneliness. So that is some data that's coming out, but I don't have definitive statistics, unfortunately, to share on that. I'm trying to recall what the second question was.
It was the issue on transgender women, and I know you had a speaker at the Women's Mental Health Coalition, so maybe we could speak about that speaker, and again, what
and there was the CSO one as well.
There's the emotional, the emotional. I suppose you've answered it there in terms of why women kind of are experiencing higher levels of stress and anxiety. I think we've already covered that.
Okay. Yeah, just to say about the CSO, they had a parallel report which showed, which they linked those findings to, which found that women were more likely to report childcare concerns and were finding it more difficult to work at home as well. So that links back to the UK study that was published, which shows about who's taking the brunt. So I think they were the themes that were linked with that. In terms of the mental health of transgender women, that's not an area I would have expertise in. We had hoped to have an advocate and expert by experience at the Women's Mental Health Network event, but she was unable to join at the last minute. I do know Belong to have done some research, which is obviously for younger LGBTI men and women, but that would be worth, if you're interested in that area, I'd direct you to that research, which does show some additional challenges, such as maybe moving back home to family homes where there's been conflict or difficulties accepting identity, perhaps around transgender issues and things like that. So I'd encourage you to look to that research for some more information.
That's great. And very quickly, two final but very interesting questions that have come in. So Mary asks around I suppose, can you talk a little about women engage with or don't engage with services due to the minimisation of women's pain and stresses? For example, when women experience violence and the impact it can have on women if they're not believed. So yeah, that I think we could spend all day talking about that as well. And then there was one final really interesting question, and other questions we can respond to in writing afterwards. But Fina from the IPRT asks, she thanks us for including the women in prison in our press release, and to Aoife and Louise for the presentation. As you know, there is a high prevalence of mental health difficulties among women who are imprisoned, along with significant rates of experience of domestic, sexual and emotional abuse. And she wants to know how trauma-informed care can be adequately provided in a setting that by definition takes away agency and autonomy, i.e. the prison. And the question is driven by serious concern that women are being imprisoned due to lack of community-based services, supports and settings. So a very interesting question there to end with. So maybe Louise, I'll go to you first, and then maybe if you had anything to add. So Louise, in terms of those two questions, just.
So yeah, I mean, I think that's a really, really thoughtful question about trauma-informed care in prisons. I mean, the idea of trauma-informed care is that firstly that the trauma is recognised and believed, and that speaks to the first question as well. And that there's a lot of work to do both in mental health services and other settings, because we know women and men who experience trauma, especially in childhood, are more likely to perhaps end up in the penal system. So I think that's certainly something that needs to be looked into more. Sorry, the first question was about minimisation, I think, of women's pain. And again, that's something in terms of bias in diagnosis and treatment that is something that's been indicated through research that women, there's potential risk for women to be either underdiagnosed or overdiagnosed compared to men and women. And I'd go back as well to that statistic I cited, which from research, which estimates that only one in three, which estimates that only 1 in 3 incidences of experience of domestic violence are picked up. So we do have a ways to go to make services and spaces trustworthy and safe and comfortable for people to feel they can disclose and build sufficient rapport to talk about these things, and that they'll be believed as well.
Aoife, do you have anything to add from the work that you're doing on those two questions?
Sure. I'll start with the minimisation, and I do think this is a major issue. Speaking from personal experience, I think that this is a huge issue in the psychiatric and mental health service provision area. I think there's a lot of stigma towards certain diagnoses that are very much over or diagnosed or towards women. Also, I think that there's this kind of stigmatization of certain mental ill or mental health difficulties, and some are even seen by professionals as more worthy of of certain care than others. I can't remember what the second question was.
So it was in relation to prisons and I suppose the nature of prisons, that they're all about confinement and taking away autonomy, and we know that the women, a lot of women in prisons are suffering from trauma, and they need support and services. And I don't know across Europe if there's any interesting examples we could look at.
Yeah, we actually have an access to justice system or project in EDF that's looking at this, but we have done some work in terms of there is a very high prevalence of mental health difficulties among people in prisons. Also, I don't know if you're aware of the NUI Galway did a report there recently about people in prison and their experiences. So that might be useful to share. And I can provide Amy with that link. I'll have to look for it. But I know there are some very interesting findings from that. But I do think it's as well, people with mental health difficulties are often, I suppose, restrained and you know, treated in a inhumane manner, and this is sometimes by the police, but sometimes you know, by other people. So that's also an issue in the way women and men who come in contact with the law, maybe due to mental health difficulties, are in fact restrained and harmed in this kind of a way.
Thank you, Aoife. And just one thing that came in the Q&A that actually we need to all keep an eye out for is that Bodywise, who are a member of Mental Health Reform, and they are the Eating Disorders Association of Ireland, they're going to be launching a website, and maybe just Cynthia can put more information in the chat on body image. So that will be a huge tool for everyone, and I think it will be hugely beneficial. So just let us know, just let us know more information, Jacinta, on that. But yeah, we've gone over time, but the conversation has been so rich, and we could, you know, chat, I think, into the afternoon, and people are probably looking forward to going and getting some lunch. But you know, I think, you know, there've been so many messages that come out, but I think that recognition, you know, we need to start discussing this more. We need to, you know, someone referred to the recent tampon controversy in Ireland this week in the chat box as well, but we need to start normalizing discussing about women's health, women's bodies. We need to start, you know, talking about trauma, and, you know, trauma that women have been through, you know, including gender-based violence, and the high levels of women in Ireland who are, you know, experience both sexual and gender-based violence. So we need to start discussing these things more, and we need to have services that are, you know, responsive, that understand, you know, the kind of the needs of women, that are listening to women, listening not only to the women that are making their voices the loudest, but those women who are being left behind, who may not have a voice. So yeah, just to say as well, like, we need to gather more data, and we need to prioritize and implement, you know, the new policy. It's brilliant to have, you know, a gender sensitive approach on paper, but we need to consult women, and we need to make it happen in reality. So thank you to both our speakers. So thank you, Louise, and thank you, Aoife. So next week, it is week 8. I've been informed we're week 7 now, it's week 8, and next week we're going to be looking at the new policy, so sharing the vision. And we are going to have some really brilliant panelists. We're going to have Hugh Kane, who is the chairperson of the Oversight Group, who reviewed the former policy, and we're going to have someone from the Department of Health, and maybe a few other speakers to look at this new policy and to see how can we, you know, move from words to action. So the invite will go out in the coming days. So I hope to see you all here next week. And yeah, just to finish up, if you do have any feedback for us, we're very open to suggestions. Next week will be the final week, but we hope to come back in September, because the webinar series has just been such a huge success, and we've had such positive feedback that we really need to continue the conversation, is what we realized. So please do fill in that feedback form and let us know, you know, in September, who, you know, what do you want to hear us talking about, and do you have suggestions of any brilliant and inspiring speakers such as Louise and Aoife that you can recommend for future webinars. But thank you all very much, and yeah, we'll see you again here next week. So Slan.
Thanks.
Thank you. Thank